So we're going to close our day today with a conversation with Dr. Sejal Hathi. Dr. Hathi was confirmed in her role as OHA director in February after serving as the state health officer in New Jersey and with the White House as a senior policy advisor for public health. At OHA, she's responsible for public health, Medicaid, public employee coverage programs, mental health, addiction services, the Oregon State Hospital, and a number of other programs. And we're just delighted that she's going to join us, and we're going to invite her to the stage. I cannot see her right now. Is she out there? No? Oh, there we go. Wonderful. Keep clapping. Yes, keep clapping. Thank you, Dr. Hathi. Sorry, I didn't realize you were all the way in the back of the room. There you go, if you want to take the mic. Thank you. All right, wonderful. Well, like I said, we are just continuing on with the conversation, and I really appreciate you coming to join us here today. We had talked about sort of working through some conversational points here. I want to start you off on, you've been here almost a year now, coming up on it, right? Can you talk a little bit about some of the achievements in that time, some successes that you really want to share with our audience in terms of what you've been able to do so far?
Yeah, well, firstly, Kathleen, thank you for having me and engaging me in this dialogue. It is wonderful to close out the session at the day with all of you, and I especially appreciate the opportunity to talk about OHA accomplishments because there have been many, in no small part thanks to the community of individuals, both within and beyond OHA who are assembled here. So I would be remiss if I didn't kick this response off with a reference to our strategic plan. Many of you hopefully know that this summer the Oregon Health Authority launched or issued a strategic plan anchored in our commitment to eliminate health inequities by 2030, and that represented the hard work, persistence, and grit. I see there's a live version. I was wondering why everyone was looking over there. But that represented the hard work, the grit, the commitment of hundreds of staff from across the agency over many months, even preceding my arrival, and lays out a roadmap for how we're going to get this very ambitious goal done. We also launched a number of programs over the last few months. Many of you were involved in the launch of OHP Bridge. Oregon became the fourth state to have a basic health plan, which extends Medicaid eligibility to folks with higher income levels, up to 200% of the federal poverty level, and we do so with no cost sharing to the consumer. We also are made strides by being the state with the highest rate of Medicaid renewals after the public health emergency unwinding. About 80% of folks were able to maintain their Medicaid coverage. This is as compared with, for instance, 4% of folks in the state of Texas, which ranked last. In no small part thanks to administrative, policy, creative decisions, again, that long preceded my arrival, we reached the historic milestone of 97% of folks covered in the state of Oregon, which is a huge accomplishment. And of course, we recognize that coverage does not equate to access, and so we are making critical investments in expanding affordability, building out the workforce, increasing the accessibility and convenience of care, but nonetheless, it's worth underlining and celebrating that shared accomplishment. And then I will also note, beyond Medicaid, because I know our brilliant Dr. Sando probably discussed our groundbreaking carceral and health-related social needs benefits for which we're leveraging federal Medicaid dollars. I also want to highlight a couple accomplishments of our Oregon State Hospital and our Behavioral Health Division. And so our Behavioral Health Division released 2 iterations of our Residential Plus Capacity report, which for the first time captured unmet treatment need for the highest acuity behavioral health patients in Oregon. And not only did they publish this report, but they also erected a dashboard which charts which beds were brought online, with which dollars, what beds are in the docket, and how long it's going to take us to meet those and our governor's goals. Our Oregon State Hospital, meanwhile, at long last, after more than a year of regulatory upheaval, did regain CMS compliance just earlier this fall, which allows us to begin with intention doing the critical work of rebuilding, restoring, strengthening some of our core patient safety and quality infrastructure at the hospital, which we are really thrilled to do. So those are just a few. I could take up the whole. I think we have 40 minutes with one another, time together, discussing our achievements. But there's a lot more work to do and a lot more to talk about. So
wonderful. And I started off by describing the scope of OHA, and you clearly have already accomplished a lot of tasks in this time. So thank you for starting that list, and we will talk about more, I'm sure. So you're heading into your first full legislative session. Obviously, you came during the previous one. But as you've been setting the agenda, what do you see as your sort of targets for this year going into? What would you hope would come from the legislature? What are some of the conversations you want to have with them this year?
So I would say, first and foremost, we have proposed an ambitious budget, and we will wait to see what the governor's budget looks like on December 1st. But you'll notice, those of you who've read our so-called ARB, that we prioritize investments in achieving our strategic goal of eliminating health inequities and safeguarding and expanding access to coverage and keeping our long-standing federal and state commitments, promises we made during prior administrations that we intend to keep, and also in advancing core organizational goals at OHA around transparency, accountability, and belonging. And my first priority with the legislative session is to support, bolster, seek to secure the funding we need as part of that budget. We are also working with our CCO partners on a number of potential legislative concepts. I don't know if Rep. Nose is still in the audience, but we are in close touch with him and his team about the range of proposals that we could adopt to strengthen our coordinated care organizations and the model of care that we hold so dear here in Oregon. And I think, I must emphasize that, especially with the federal election just a few weeks ago, all of us will be working together to ensure we can safeguard essential freedoms, values, and rights, and continue to make progress on our shared goals of expanding access to health and opportunity for all Oregonians.
Wonderful, thank you. And I certainly think let's take that conversation a little bit further. Throughout the day, we've talked about the implications of the federal election and the swinging back and forth between Republican and Democratic parties that we've seen over the last 8 years. I can't do the math very well in my head, but there's been a lot of change. We have focused to some extent on the Medicaid implications of that. We all recognize we honestly don't know, as Emma was just saying earlier. If somebody tells you they know what's going to happen, they don't. But I want to talk a little bit more broadly, maybe still including Medicaid, but are there other programs, are there other topics that you have in either the public health arena or other arenas that you have in mind, given the federal elections, and what kinds of programs you might be thinking about or looking at or working to protect, as you just described?
So I think Seamus said it best when he noted that his staff, all of us, are reeling from the results of the election, and yet we haven't let that shock, that grief, that consternation derail us from doing the real important necessary work of identifying and beginning to inventory all the steps that we can take to mitigate the risks posed to our values from the change in administration. And so long before the election, OHA conducted a tabletop exercise examining Project 2025, looking at the articulated preferences, policies, and convictions of the president-elect and his likely appointees, and examining which of our programs stand at greatest risk and what we could do to support and safeguard them. You rightly note that the potential dangers extend beyond Medicaid. I am deeply concerned about our reproductive health programs, reproductive health funding, our basic public health infrastructural investments, the range of grants that we receive from the CDC to support STD response, treat HIV/AIDS, and invest in data modernization and infectious disease surveillance. And of course, there's also just the depth of disinformation and distrust that certain members of this transition team seem all too willing and eager to foment and to spread. And we must, as an agency, stand as a beacon for evidence, for truth, and accordingly will be working to ensure that we can both elicit and respond in real time to questions, to fears, to uncertainties that both our partners and community do express. So we're doing a lot of the legwork right now of figuring out how we can continue to support our programs, support our staff, and support our community, and safeguard access to health and health services that have distinguished Oregon as among the best states for health coverage in the nation.
Wonderful, and I really appreciate you taking it beyond just the funding, because certainly that is concerning for some of those programs. But there is the sort of public understanding, and I think that that's something that, to a large extent, communities have always looked to the local public health, the state public health initiative voices to help with. So I think that's really important.
And then I'll just note one thing. I heard a comment in the prior panel. I just walked in the room, so I very possibly could have misconstrued it or otherwise heard it outside of its intended context. But I don't think, while we must invest in and embody a stabilizing force, stability is not an excuse, is not or should not be a replacement for progress. And so while I believe in streamlining administratively burdensome requirements where we can and we should, we must continue to set higher standards and hold all of the entire healthcare ecosystem accountable if we're going to make meaningful, sustainable improvements on our existing health coverage and delivery programs. And so while there is sometimes an inclination to retreat, to guard, to resist by potentially doing less, I want us to continue to march boldly forward, to put forward visionary new ideas, to continue to be the first in the nation to think about and pilot new approaches to addressing healthcare and upstream needs. And we're only going to do that if we approach the next 4 years from a place of optimism and not from a place of fear.
Yeah, I think the mood was to continue forward despite, rather than as a bunker mentality, but more of making sure we protect the progress we've been making and then continue forward. So I think that's terrific. Are there any specific initiatives or components or things that you see as being your markers for that progress? I know you've talked about inequities. Are there other components to that or specifics within that when you think about what you see as making that progress forward? Are there any things you would add in terms of specific initiatives or areas where you really want to see progress? If we're going to get to reducing inequities, is it in housing? Is it in poverty? What kinds of things are you really digging into in that space?
Yeah, so we identified 5 categorical areas for focus as part of our strategic plan. The first being transforming behavioral health and both reckoning with and addressing the crisis of behavioral health unmet need across the state that has emerged over the last several decades. The second is expanding access to affordable care. And there are a number of programs and interventions that OHA has led over the last few years to continue to make progress in that realm. The third is on achieving tribal communities. The fourth on fostering healthy families and environments, and that's really where we are prioritizing investments in prevention and in public health. And then the fifth is around investing in our own internal infrastructure and workforce to be a model for this type of work. And so a lot of the work that we are doing, that we're hoping to do, that we're proposing to do in our budget, it advances those 5 pillars, which we see as clarifying and crystallizing this ambitious goal to eliminate health inequities by 2030. And then on top of that, I will share that we know no single agency nor state government can uproot inequities that really have accrued over generations of structural racism, of bias, of misogyny. And accordingly, we, on December 9th, actually, we'll be announcing what we're calling a statewide call to action, eliciting commitments from all sectors, business, philanthropy, academia, civil society, that bring us closer toward that 2030 goal. We're looking forward to mobilizing a coalition of partners across the state, because we know we can't do it alone. We know that we have to demonstrate to ourselves and to the rest of the country that health equity is still important, is still valuable, is still possible to achieve if we all work together. And if there were ever an initiative that I, in response to your question, would call my own, it's really this desire and intention to enlist non-traditional partners, traditional gatekeepers of power, to build that statewide coalition and really a movement that demonstrates what's possible if we all collectively row toward equity.
Wonderful, thank you. I'm going to pick up on your 5th pillar, I believe. You talked in your opening comments about relying on your team, your staff, the folks at OHA and within the state agencies. We all know that we've been surviving some challenging times, and emerging from the pandemic, public health infrastructures and other things haven't received a ton of investment over decades. But there's also other challenges that exist. So as you think about your team internally to OHA, what do you see as the most pressing concerns, and what do you need to navigate within the agency to achieve the goals you've been describing?
Yeah, so I appreciate this question because what we achieve externally is, we know, at least partially predicated on who we are and how we live our values internally. And so we are making investments in our budget and otherwise in shoring up staff morale, in promoting employee belonging, and investing in professional development opportunities so all of our staff feel like this is a workplace where they can grow, where they are seen, heard, and valued. And one of the initiatives that we've launched to better support our staff over the last few months is something we're calling the Transparency, Accountability, and Belonging Initiative. And this is a series of projects, just under 24, that build core organizational capabilities that we believe will equip and empower us to more consistently and transparently deliver on our stated commitments, keep our promises, improve customer service, and strengthen partnerships across the state. And so I would say one of my biggest focuses internally, beyond simply building our full leadership team and continuing to shore up our staff, is investing in those projects to increase transparency, improve accountability, and promote staff belonging, so we can be an effective government agency and deliver on both our obligations and our aspirations.
Wonderful. So going beyond the agency, within sort of the communities in Oregon, what do you see as the biggest barriers? You talked about bringing partners together and non-traditional partners in achieving health goals. What do you see as the biggest challenges to that in terms of moving as you said, progressing forward in tackling equity and in tackling access issues that you've identified? What do you see as the biggest barriers out there in the community?
So I will respond to that in two ways. Firstly, a lot of these problems are not new problems, and there are no short-term fixes, and no easy solutions. Our behavioral health crisis, our public health, ailing public health infrastructure, even some of the challenges that we're witnessing and experiencing at the Oregon State Hospital, those are long-standing. They've existed for generations, and they're going to take multiple biennia. At persistence, continuous investment, partnership with our friends in the legislature in order to make a meaningful dent. And so if there is any barrier in that vein that I would cite and highlight here, it's the need for patience. And I recognize in a moment like this one, amid a crucible of uncertainty and change, patience can be hard to accept, and yet we have to celebrate the small wins. We have to recognize that incremental progress is still progress, and sometimes it can take a while for investments to bear fruit. And so that's one barrier that I will highlight. And the second, I think, became evident to me in a series of visits that I made in my first few months here. So one of my first priorities in assuming this role was to ensure that I understood the real lived experiences, needs, and challenges of people across Oregon on the ground, and that the vision that I set for the agency reflected those voices. And so I did a statewide listening tour, and I learned that the problems that folks in Portland face very different from those that folks in Pendleton might face. The behavioral health crisis in Astoria looks different than it does in Coos Bay. And so we can't administer one-size-fits-all solutions. We have to recognize that geographic inequities are part and parcel of health inequities, and make sure that we are accounting for the diversity of our state, both in our workforce as well as in our policies, in our funding formulas, in our messaging about the work that we do. And so I think it's just making sure that we are adopting a polychrome approach to policy and acknowledging and accommodating a multitude of views and stakeholders and communities in the work that we do.
So the state of reform audience that you have before you is the policymakers, the industry leaders, the associations, the providers, the hospitals, and others, vendors, et cetera. There's a wide group here. When you think about what you need from outside the agency to support you, thinking about this group here, what do you seek from them? What do you need in order to move this forward? Any requests of the audience, so to speak, before they get a chance to ask you questions?
So this is, I guess, our last question. So what I will say is one of the best parts of Oregon, one of the lures, one of the draws to my coming here, I think is the magic of partnership. It really takes a village to get some of these big things done. And one of the things I really appreciated about Oregon was how committed, how engaged, how interested and invested were folks across the healthcare ecosystem, from our CCOs to our local public health authorities to people who had previously served in government who are still very active, still very vocal. To all of you here, you care so much about ensuring that we continue to make progress. You hold me, you hold my team accountable. And I want to continue to hear from you. We're always thinking about how can we do better by the diverse array of voices in this room. How can we create more inclusive and participatory decision-making tables. I know that in some areas we have done better than in others, but every time I hear from you, every time our teams hear from you, you make us better. And so I would say don't hesitate to reach out. One of the projects that we will be advancing in that Transparency, Accountability, and Belonging initiative is creating more systematic ways for eliciting and responding to community feedback, because we know that that feedback is necessary to help us grow and better deliver for the people that we purport to serve. And so participate in our rule advisory committees, join our tables on the prioritized list, reach out to me to directly share your feedback, and come December, we really will be looking for big and bold commitments from prospective partners, new and old, across the state, across all sectors, and I'd love to see folks in this room participate.
Well, this is your opportunity to begin that participation. We are going to take questions if folks want to dive into anything. I think we have some mics out in the room. I see. Oh, I'm sorry, I didn't see you right here. And I thought I saw a hand back there. She's coming.
Dr. Hathi, thank you for being here, and thank you, both of you, for all that you and your staff have done to make CCO successful. Most of the patients I talk with are happy with the care they receive from CCOs, ... until they get a promotion or a raise, earn a little too much money, and fall off the fiscal cliff. Please tell us how you help bring the benefits of CCOs to all Oregonians. I have one suggestion, of course, and that is universal health care plan that the governance board is working on. One problem I see with CCOs is their dependence on the capitation systems and value-based systems. They have high administrative, financial, physical, and emotional costs to providers. Such capitation systems also contribute to moral injury due to the perverse uncertainties to avoid costly patients and procedures. Would you consider turning the management of CCOs back to direct state management without private intermediaries? 14 years ago, Connecticut took back its direct management and saved 14% for the last 14 years. Comment?
Appreciate the question. I will say that the coming CCO procurement, starting with the Oregon Health Policy Board meeting on December 3rd, will offer ample opportunity for the public to engage, provide input, and otherwise inform what the next iteration of our CCOs look like. So I encourage you to participate in those opportunities to share your views, and I'm sure there are others in this great state who agree with you. And our job, our responsibility at the Oregon Health Authority will be to listen to all of those viewpoints and do what we can to move the CCO model forward.
Thank you, Dr. Hathi. Other questions, thoughts, perspectives? Wow, this was not a quiet group earlier. Not sure. I did put them through the ringer, though, going right from one session to another, so.
It's also been a pretty long day,
Yes.
as I understand it.
All right. I'm going to ask you one more question, and then we'll wrap it up. Anything we haven't talked about yet that you want to make sure that we do, or any closing comments from you?
I just want to thank all of you for coming today, and to my team. I see many of you in the audience. Thank you for the incredible work that you do each and every day. This is really just the beginning. We have a lot in the pipeline, and I'm excited to share that with you over the months ahead.
Thank you, Dr. Hathi. I have not been here terribly long, but I have noted that there is this odd phenomenon you all have. I call it the rush half hour. It's never rush hour. Where I come from in DC, rush hour was about 4 hours. But I do know that we want to go ahead and wrap up on time. I Really appreciate all of you. I really appreciate you coming in and rushing from the back of the room. So sorry about that, putting you on the spot that way. But really appreciate you sharing your thoughts and perspectives here today. Please join me in thanking Dr. Hathi for his And with that, we are adjourning our 2024 Oregon State of Reform